member for Dartmouth North.
Madam Speaker, midwifery-led births account for only 5% of total births in Nova Scotia, far below the national average of 14%, and I can table that. This is a disservice for expectant mothers in Nova Scotia, given many positive health outcomes associated. Midwifery support leads to more natural births, a decrease in C-sections and surgical interventions, easier breastfeeding initiation, and it decreases the chance of having a preterm birth. Not only does it take the stress off of new moms, but it also takes stress off our hospitals. Does the Minister of Health recognize the importance of midwifery care in our healthcare system?
The Honourable Minister for Health and Wellness.
Again, we spoke about this yesterday in the chamber. Certainly midwives have a role to play in prenatal and obstetrical and gynecological care. In fact, there are things that they can do around supporting women's wellness. So we have a couple of areas outside of the city. So certainly IWK has some midwives, and we do have some areas. It certainly is not easy to maintain the staffing complement in those areas. We're also making sure that midwives are part of a team. We need to ensure that they have nurses that are around them. We need to make sure they have primary care physicians who do obstetrics. We need to make sure that they have specialty services to support them in terms of, yes, many deliveries are usual and regular, but we need to make sure that they have the infrastructure around them. So we do continue to look at women's health issues, and we'll continue to assess the situation as we move forward.
I recognize the Honourable Member for Dartmouth North.
As the Minister's response shows, it's hard to ignore the benefits of midwives that they add to our healthcare system. Investment in midwives is simply a smart policy, yet there are only 16 funded positions and 3 practices in the province. Many communities, as the Minister said, across Nova Scotia lack essential midwifery care. The budget yesterday was a missed opportunity for this government to address the critical shortage. Why is this government not investing in midwives?
I recognize the Honourable Minister for Health and Wellness.
Nova Scotians are not missing out on good, quality, excellent obstetrical and gynecological care in this province. And midwives are a part of that team, but they are not the only members on that team. So we know that midwives play a role. We have 16 positions. They've been very difficult to date to fill. We continue to work with Nova Scotia Health and IWK to better understand how to support them.
Order.